Okay, so we're going to be having an interactive session today. You know, so it's going to be our Q&A session. Then, more like we're just going to have a glimpse of what happened for the past 3 days. I'm sure that each and every one of us is, if you attended this training for the past 3 days, you should have started having, that consciousness towards the anatomy of research writing. One thing I usually tell people is that research writing is really, really very different from academic writing, or research writing is different from content writing, right? So you can see people who are very good in writing content, and many a time when they switch towards research writing, they find it very difficult because it's an entirely different concept. But yes, you can actually build on what the concepts the discipline and attitude you've portrayed in content writing. But when it comes to research writing, you realize that it's a little bit tricky. It requires you to put you know more effort in reasoning, not just more effort in participation, but more effort in reasoning is very, very imperative. So before I project what we have for today, I'm just going to I just want us to have like just the snapshot of what we did in the 3 days. I know we already have the slide, but it will be very important for us to just take a look at what we've done. So in our day one, we started by talking about I'm just going to be very brief with it. So we started by talking about the research paradigm and introduction to systematic review. Then we looked at systematic review, the hierarchy of evidence, importance of systematic review, the paradigms, the major paradigms, and we tried to look at the relationship between the research paradigm and methodologies. And then we went through questions and their paradigms and also practice questions. So we explained systematic review to a 6-year-old, Then we looked at the hierarchy of evidence, and this picture, he was just trying to tell us that systematic reviews is sitting at the very top, right? So just like I mentioned that we can decide to host a class for clinicians. We've had a class with clinicians who are looking at conducting their first randomized control trial. Randomized control trial is a type of experimental study, right? So it's very closer to what systematic review is, but it's still a primary research, where we said that for you to do a systematic review, right, primary research is very important. Then we talked about the importance of systematic review, which we all know by now, and we looked at its various tools. And we made it very clear that for you to become a wizard in this aspect of writing a systematic review, it's very important for you to learn how to play around the tools. And we just gave us what we had. All we've discussed in these 3 days is just like the tip of it, right? So that's just it. And I'm sure each and every one of us have a very clear understanding of what we are going to see at the end of the tunnel. So we just looked at all these stuff. Then we tried to differentiate between the systematic review and the traditional and the normal literature review that you do, in school, where we explain explicitly, using the criteria. That the systematic review has a very detailed approach that it follows compared to the traditional research. Then we welcomed us to research paradigm, how we could reason, and we understood research paradigm as how we view the world, right? How we view research, so it can be qualitative, quantitative, or mixed. Then we made a very clear call to evidence that we have 3 core paradigms, right, in research, where 3 major paradigms, which is the positivism, the critical realism, and interpretivism, right? So positivism is more for quantitative, interpretivism is more for qualitative, and critical realism, as well as pragmatism and all that. So we made it clear that we have other paradigms too that we didn't really look at, right? Like we have the feminist paradigm, we have the theist paradigm, we have pragmatism, we have constructivism, a lot of them, right? There's something we call the research onion, when we will go further in this training, right? And one thing I was trying to make us understand is that if if you're learning systematic review from our team, you're not just going to be good. You're not just going to be good in the aspect of writing a systematic review. You're going to be good in research. Because one thing I tell most interns, or most of my interns, is that when they start learning systematic review, it doesn't just we're not just exposing you to how to do a systematic review. It also covers every other thing in research, because on the course of you going through all the methodologies to put it into an inclusion, right? You expose yourself into the knowledge of research. In short, as a matter of fact, I got to have a very detailed understanding of randomized control trials because I started learning, because I knew how to do systematic review. So we are those people, we are the people that will take you to that destination, right? Because we understand your problems, we understand how it's paining you. So we know how to actually address it. So that's just your paradigm. We talked about positivism clearly, interpretivism, critical realism, which is the mixed approach. And we try to look at the interception, right? Where we talk about ontology being what? How you view reality, right? Which is clear, you can see it. It's something you can see, it's objective, it's measurable in terms of knowledge when you want to draw knowledge. Whereas for interpretivism, it's based on subjection, right? You can't really see it. It's something that you heard from somebody, right? It's in your mind. And again, it's based on experience. So we linked it to qualitative, and that's qualitative studies, and this to quantitative and experimental studies. So this is just clearly mixed, right? Good. So we looked at examples, we looked at diverse research questions for positivism, we looked at diverse research questions for interpretivism, which is qualitative. We're looking at more of experience, right? So we also looked at, further research questions. I also looked at research questions for critical realism, which is more like a combination of positivism and what? Interpretivism. And we sent the practice questions. So that was for our day one session. Then in our day two, we looked at how to formulate a research question, right? So we started by explaining, we did the branches, we talked about what research question means, research questions in systematic review, types of research questions, models and frameworks in formulating your systematic review, in formulating your research question, yes. So we did a detailed baby approach and infant method of considering a systematic review question, and we did practice questions and action play. So we got this fat dog, which actually got married. And we looked at some of the research questions that were asked using diverse frameworks like the SPIDER, PICO, PEO, and PCC framework. Then we explained what the research question means, and in simple terms, we looked at it as for a baby that wants to understand what the research question means, right? Then we talked about research questions in systematic review, which is just like getting the clear big picture. Then we differentiated between quantitative research questions, qualitative and mixed method. We now explained quantitative research questions to be any type of research question that is numeric, right? Yes, it's numeric, or it tries to answer numeric questions. I hope you can hear me clearly.
Yes, sir.
Yes, we are with you, Professor.
Can you guys hear me clearly?
Yes.
So we talked about the qualitative approach. Then we now summarized we have talked about the mixed method. So we talked about how to formulate a research question using SPIDER, the PEO framework, the PICO framework, and the PCC. We also considered other models like the SPICE, PECO, FINA, Eclipse, and we also said that there are also diverse frameworks, right? That we didn't really look at because of what, how wide our discipline could be. Then we took clear examples, right? And then we proceeded to formulate it. Then we had a clear picture of this, and we're able to just look at this picture to come up with diverse questions. Then we also talked about how research questions emanate from, right? So it could be from personal experience, supervisor suggestion, current trends and issues in the field, gaps in literature, patient or community feedback in and needs, right? Experience with your ex. And we looked at practice questions. So that was all we did for day 2. So for our day 3, we talked about how to identify gaps in literature, which was one of the longest series we had. In short, but of all the series we had, day 3 happens to be the longest. So, which is very, very important anyway. So we started by explaining what research gaps are, what are gaps. Like we needed to understand gaps itself. And we talked about systematic review research gap, talked about what is rational and systematic review, right? We talk about considerations in gap identification, the winning approach. We talk about the tabulation approach, how the objective approach in identifying your gap, where we made it clear that it is possible that for somebody to identify, it's not anything in research is usually objective and subjective, right? So it could be that you're making your position based on experience, what you feel like it has not been done. Because when you talk about gap in research, it's all about what is new, what's the missing, what is missing. That's the gap. So talk about Boolean search method, which we didn't really go in details because we are not looking at search strategy at this stage of the training. So we did some practice, with the research question, and I gave us practice questions to go. Then it was just a very clear picture of what we had done before the day for this particular training, where we looked at paradigm, question, and what's new, because everything works hand in gloves, right? Good. So we had our paradigm, research question, and what's new. So we looked at the gap as what's missing, simply. For a baby, just trying to arrange the puzzle, there is something missing. And we looked at this very funny picture, right? Then we talked about the systematic research gap as, it's just literally what is missing. But then it's now more like, what is that? He just tries to provide research, more comprehensive understanding of what we really need to do, right? So it could be that, and how can a research gap in systematic review emanate? It could be that maybe probably there is inconsistency in findings, right? There are a lot of studies that are talking about malaria in Nigeria, for example, prevalence, and there is a lot of varying views, right? This one is saying 40%, this one is saying 90%, this one is saying, so the systematic review is needed to bridge that gap in inconsistencies. So that's just it. Then we just looked at this, which was explained further in the previous slide. So we say that a systematic review rationale is all about why this topic. That is just what it is. It's all about what? Why this topic. Then, which is just Tell us why you chose this game and why do you want to play this game? Why is this game more better than others? What game has been played that is different from this one that you want to play? It's just what you need to write in your rationale, right? Which we explained. Then we now say that it is not enough, it is not just easy to identify the gaps. You cannot just start searching literature empty-handed, right? So you need to have some things to consider before you identify gap in literature, because this life is it's just very simple if you always have something in mind. Because if you're just being controlled by the metrics, you're definitely going to lose. So what does it mean? It means that for you to identify gaps, right? So you need to put in a lot of consideration. You need to have a detailed population group in mind. You need to have a detailed interventions group in mind. So it's all about going in deep, specific, making sure you narrow down your focus, right? So it could also be based on study setting, right? So sometimes your gap could be that you found out that the study was conducted in Africa, and it might not have been conducted. If it's conducted in West Africa, the results might change. So that's the situation. You can actually use it to do it, navigate through your gap. So it could also come by outcomes, to come by designs. Maybe the study used randomized control or experimental, whatever, right? So it could be based on methodologies. It could also be based on the comparator group. We explain all this in details. You can find the link in this video. And also based on duration of the study, right? So it could also be a primary reason for us to identify gap in literature. So it could also be based on health conditions, right? So maybe you're doing a type of review that deals with comorbidities. So let's say diabetes in Africa. Maybe you could say diabetes among maybe HIV positive women in Africa. That's gap. That is gap. And remember, for a systematic review to be eligible, it means that there are primary studies that are clearly set out to address your question. If they are not there, then it's going to be impossible for you to work on that. So the same thing applies to healthcare providers, right? So you could also use that to do what? To draw your gap. So you could be working with doctors, maybe you could delimit it to maybe the previous study you found is doctors, maybe exposure to infectious diseases in a hospital. So you can try to address that systematic review gap and say, okay, maybe you want to look at nurses this time, right? Or is there already an existing study? If there is, has it been conducted in low and middle income countries, nurses in low and middle income? So that way, when you play around your variables, you're able to formulate a systematic review and you're able to identify gap. And not just identifying gap, you're also able to do what? Contribute to knowledge, because if you're just playing around the variables and they don't have any potential implications for practice or for policy making, then it doesn't really make any sense. So also it can also come from cultural context, because thematic review is not just for healthcare, it can also go beyond that. And also other variables like buyers and facilitators. We also say the yes, time duration is also important. A thematic review of the same topic can be conducted in 2009. You can still do the same topic in 2024 and make your justification based on what time duration. That means you need to provide an update. So we looked at yes, also here policy and practice. Yes, I talked about that already. So we can also identify gaps based on regulatory frameworks. So questionnaire is also the same thing, doesn't change. All these things here is similar to methodology, or depending on the context. And theoretical framework also can inform your gap. So we came on what we call the Sentinel's model, right? This is clearly the Sentinel's model for gap identification, right? So you won't find so many PhD students, right? I had a meeting earlier with 6 PhD students, right? They just started their PhD recently, and I think that was really on. These are students that finished from their clinical practice, and you see the same question, right? Trying to identify gap in literature, and it will never change. The approach will never change. It will always remain the same, right? So you pick up this checklist, right? You have something in mind. You go online, you look at the study author, you look at the year, you make comments. This study was conducted in so and so year. That means it is possible that if I do it in so and so year, there might be a change in result. You look at the type of objective. you make your comment. Look at the type of population that the study used, you make your comment. You look at the type of intervention, you make your comment. You look at the approach that the study used, the paradigm, the data analysis method, you make your comments. All these things that are here is just those considerations that I've made. I made consideration of study setting, I made consideration of study design where I talked about randomized control trials and all those. I made consideration of paradigm, which could be rooted to theoretical position. Because when we talk about paradigm, it is more closely related to your theoretical framework. If you're writing a PhD systematic review dissertation, you might be asked to do your traditional literature review and also do the same methods. In your traditional literature review, you always make arguments of your theoretical framework. If you're an undergraduate here, your literature review must contain a theoretical framework. And these are these are clear strategies for you to be able to see what has been done in all these studies and be able to summarize it and see what is missing. Right? So your gap identification process has to be thorough. So something applies to your study setting, the type of outcomes, and the overall comment. So this is the very simplest thing you can be able to do. It's all about sit your ass down and do what you're supposed to do. So we went into practice, which is the same thing as this, and we did our practice. But then before we started the practice, we explained the Boolean search approach to help us in the search, because for you to talk about doing all those studies in, you need to have at least a basic knowledge of how to combine your search terms, right? So where we say that if you have a particular term, you need to look for synonyms or what we call mesh terms. Mesh terms in medical field is what we call the medical subject headings, right? Yeah. So if you're an expert already, maybe like me, so I can decide to use what we call, you use these medical thesaurus, or I can decide to do reference list search, manual search, which is also applicable. So I could also do more sensitivity search, play around truncations, use what we call wildcards. Wildcards, we use wildcards, proximities as well, in our joining field. So it's just very clear that all these things, you don't really need the information at this stage, right? What you just need is just do your and are up. You can even search for, let's say you're searching for a job in LinkedIn. You want that job to have a mango profile and an orange profile. So you can just, on LinkedIn, the Boolean operator works on LinkedIn. You can just use your or and operator or not, which was not really anyway relevant here. So we practiced, and that was all we did for our second day. So that is that. So for our day 4, it's just, we don't really have much to say, right? So we've just talked about a recap of our training, and I'm going to talk to us about the mentorship session. So we have the mentorship session coming up by the month of September. Yeah, so I'm sure each and every one of us is very, very excited about it, because a lot of people are really excited. They want that coaching session, they want that one-on-one session, they want that detailed approach on the anatomy of research, supervision, making sure we watch you right, give you the necessary tasks, engage you, and in 2 months' time, you become an expert. You have the capacity to train, right? So here's a breakdown of our mentorship session. So these are our packages. So we are very, very excited to, introduce our mentorship session to each and every one of us. So we'll be giving us a detailed anatomy of research writing, right? After 2 months, even your child, even your baby should be able to write systematic review. Trust me, I'm very, very sure that a 10-year-old can write a decent review. I believe it. Forget jokes. It looks as though we are playing, but this is just a reality, because a 10-year-old should, once you tell the 10-year-old what is needed to do, the 10-year-old should be able to do it, right? So that is the approach we are using. So it's going to be a private and detailed session, writing. We're also going to introduce you guys to our experts, who have actually really been very engaged, before now. So they let me out to handle you guys. And yeah, so it's going to be a start to approach. So we're going to teach us how to use numerous software. So it's coming with a lot of packages, right? So we teach you guys how to use what we call the Providence software, the Ryan software for data extraction, and also going to teach you how to use R and Revman, right? So we're going to share the software to us, crack version, teach every one of us. We install it, and we'll be able to perform meta analysis. Trust me, there are loads of information. So if it's information for us to take grasp of, right? So that's going to be from September to going on from September and October. Okay. So here is our plan. So for some of our PhD students who are already very crazy, really ready to enroll into it. So it's going to be $200 for the PhD students and for undergraduates who are actually going to stay with the basic plan. So just tell me, everything we have here is just our normal plan, right? You're going to get everything. So it doesn't matter if you subscribe for the basic plan, but then for the PhD students, they're going to, have an intense practice of up to 3 systematic review research questions per person. So that means you have the ability to work on 3 different systematic reviews, and you have that exclusive guidance from our experts, to have your first publication in a systematic review before the end of this year. So this is just basically how our training is going to play from September to November. So we're going to communicate September and October. Yeah. So it's going to be 2 months. We're going to communicate to each and every one of us via our the emails, right? Keep in touch with you guys. So I'm very sure you have that zeal and desire, to become an expert, not just in systematic review, but in research in general, because navigating through the process of the Prisma checklist will let you have that very fantastic knowledge that you need just in RCTs, cohort studies. You can have the ability to write cohort studies. And for those of us that are going to be on the also be on the normal plan, right? So you definitely have your publications, right? But you have a lot of narrative review publications out there for you, and you'll be added to our wide systematic review community, that we're coming up with, right? So it's just going to definitely expose you to all the needed information that you need. So this is just the highlight for any participant, that's going to enroll for our detailed session from September, right? So the flyers are going to be made available. We are going to have all the details, where we need to register. And also at the end of this training, we're also going to offer us, just a mini certification for the participation, because I'm sure each and every one of us is really very loaded. And you know how you see your paradigm, that is the same way we expect you to see all the very aspect of this systematic review. Trust me, there's one very tricky aspect of systematic reviews, which is the meta-analysis, where people find it so difficult to conduct the meta-analysis. And we have 3 types of approach to doing our meta-analysis. We have that for the effect of intervention, we have the diagnostic accuracy meta-analysis, and we have what we call the descriptive meta-analysis. So it's just an opportunity, that we'll be looking at each and every of it to grasp. Please, this is not going to be this is not just going to be the price in the next 2 weeks from now, because in the next two or 3 weeks from now, we will have an improvement. But the reason why we decided to portray this here is because we know that so many of you that are already in attendance here would have will be exposed to this information here. So it's entirely up to you, to push yourself further. And like I said, also for the data extraction is going to be more of a combination of the Providence and REM. So we also forgot, there are also some other applications that are also going to come in. We teach us how to use the Zotero software, which I'm sure a lot of us know how to use, Zotero EndNote for those of us who are beginners. Zotero EndNote. So it is just from being a basic, you have not having a knowledge of doing a systematic review to being able to conduct a training. So we're not just going to drag you along to be able to write. At the end of this training, you should be able to conduct a training on systematic review. So it's not just about you having your manuscript for publication and all that. So please, just like we said, by next 2 weeks or thereabout, we'll have a change of price. So for our PhD students or clinicians, or even if you're an undergraduate and you feel like exploring the premium package now, it's up to you, right? So from some of the PhD students, maybe from the UK or wherever you find yourself, maybe in Canada or anywhere, right? So it's an opportunity for you to put in effort, do what you're supposed to do wherever you are, and you don't really understand the essence. So yeah, that's just how it's going to be. So I want to really thank you guys very, 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 very much, because it wasn't really easy, you guys, for your cooperation, and the fact you guys were really, really able to get in here. So the floor is open. Let's ask our questions before we call it a blast, or we call it a day. So you can ask your questions. We don't really have so much to put into our discussion, so you can ask questions. So yeah, ask your questions, ask your questions, ask your questions. Yeah, Joyce. So you can ask a question of which of the training days, any question you have,
Okay.
before
Good
we call it.
evening. Good evening,
Yeah,
Mr.
good.
Anderson. Thank you for the session so far. I've learned a lot. So there's something that you mentioned during, I think, was it day two, that you mentioned about exclusion and inclusion criteria for systematic reviews for the studies to use. So I want to ask, what does the exclusion and inclusion criteria entails? And then secondly, not as much as a systematic review, it's done to reduce biases. Are there likely any biases to come up in the systematic review? If yes, what are those biases, and how does one avoid them or tackle them? Thank you very
Okay.
much.
All right, welcome so much. So very clear, right? Let me start from your last question before I move to the next question, to the second question, which is about exclusion and exclusion criteria. So yes, when you're conducting a systematic review, right, there's always a provision for you to report the limitations of a systematic review, and there could be bias. Now, one of the bias in a systematic review is that, first of all, if a systematic review is conducted solely by two persons, and there is no, there is no, let's say, for example, there is no intervention of a third person to always balance the check, right? So it means that the bias now could come from selection of studies. Do you understand? So it means you have actually clearly stated how you're going to perform the review, and it's just two people that made the judgment in the set of papers that actually qualified to be included. So that means it's possible that you could have actually omitted some certain papers that might be relevant, or some of the papers you put into your review process might not have really had that strength. And again, there is something we call quality assessment in systematic review. So quality assessment is all about, quality assessment is simply, it entails you the tool we use. There's something called risk of bias. We always perform for every systematic review. We always perform risk of bias, and the risk of bias we perform is that it's likely that someone can actually include a predatory publication. What do we mean by a predatory publication? Let me say, there are tons of journals out there that are of low quality. All those type of journals where you submit an article today and it's published next tomorrow, right? So some of these journals are predatory. So by predatory means they just take money from you. You give them $20 or give them 10,000, whatever thing. You just give them some cash and they publish the article. So let's say somebody is conducting a systematic review and he includes that type of article that didn't really go through rigorous peer review, because one of the things that actually makes a journal predatory is that people have their work published without going through high quality or high impact journals that leave the study through rigorous review. So in that situation now, when that type of study now that didn't really go through rigorous review, because the whole rigorous review is that you submit your project, let's say for example, your primary research, your project, and you made a lot of mistakes in your methodology. Because what your methodology now, the methodology now that you're reporting now is what that systematic reviewer will use. So it means that when that journal now publishes your report or your project, right? It means that there is likelihood for that systematic review finding to have bias. So there could be. So it means that whenever you're performing systematic review, it has to go through what? Risk of bias. So there needs to be thorough risk of bias. Risk of bias is also another aspect of the training, right? Which is what we call the quality assessment. So we're not just going to teach us how to do risk of bias. We're going to teach us how to do risk of bias using diverse tools. There is over 21 tools that can be used to perform your quality assessment. You have the NORS checklist, what we call the Newcastle-Ottawa scale. We have the Pedro scale for physiological evidence. We have the CAPS checklist, which is the critical appraisal skill program form. We have the Cochrane risk of bias tool. We have the updated risk of bias tool. We have Robbins scale. We have the Robbins scale. We have the GRAD. There's the GRAD tool. We have a lot of them, a lot of checklists that we use in performing our risk of bias. So it means that when you get to that quality assessment stage, you don't just expose yourself to people that will just talk about it up. No, you need to do the practicals. You need to use the studies, do the practicals, and see how to identify those bias in all those primary studies. So that when you now have those bias, you can be able to even put in your inclusion criteria that if there's any study rated 10/20, it will be excluded. That you only include studies that are rated from 18/20. So all these things are going to be explained in details, right? So that is what we call the quality assessment. So a systematic review can be posed to bias. Again, is language restriction, right? So we also have what we call the language translator. So let's say you're only including studies that are published in English, right? So you can be able to use the language translator and translate. I'm sure most of us have not really seen that, but we are going to show how you can actually use those tools to do it in detailed practicals to convert your maybe a French publication. Maybe you saw a publication that was published in China and actually convert it to English. So it means that bias could be that for the fact that you've excluded studies not published in English, it has limitations, not just bias, but limitations. A systematic review can have limitations. Now, about your question on the inclusion and exclusion criteria, yes, of course. We explain that because we are following the checklist, right? So the inclusion and exclusion criteria is formulated with a model. The same model used in formulating your search question can also be used to formulate your inclusion and exclusion criteria. Then you put what we call the other considerations into it. So it's really going to be a very, very massive one, coming up. So I don't know if there's any other question. I don't know if I'm sure I answered your question very clear.
Yes, thank you. Thank you, sir.
Yeah. Ask a question. The next. Ask your question.
Just a few minutes ago, would there be recording for this particular meeting, like recording so that I can go over it
Yeah.
and
Yes. Okay, you mean this particular meeting now? If I will send the recording. Yes, it's being recorded. I'm going to send I'll send the link I'll send the meeting link to us. So I don't know if there's any other question. I see that we really, really understood the whole. Okay, yeah, ask your question. If there's any other question, you can ask. Mohammed. Ask your
Okay.
question.
Thank you for your time and presentation. So I want to ask two questions. In the one you have
Okay.
discussed the tools used for conducting systematic review, I want more clarification on this. And my question number two, I want to know how can I develop strategies for identifying and handling ethical issues related to my own field of research and how to avoid pitfalls in research that can lead to plagiarism. That is my question, sir.
Okay, you're asking a question. How can you develop what?
How can I develop strategies for identifying and handling ethical issues related to my own field of research and how to avoid pitfalls in research that can lead to plagiarism?
Okay. That's a very good question. Okay, like I said, we the training cover, yes, okay, yes, in as much as that's the question outside. When you want to formulate your search strategy, right? So there are what we call keywords, right? So there's something we call keywords. So the very first thing we do is we first of all start by playing around the primary keywords, which we use, in short, not just that, we use our research, we use the same model. Now listen, when you have identified a model suitable for your research, now the first thing you need to do now is to use that same model to do what? To formulate your research question. So when you now formulate your research, to formulate your search strategy. So you split your let's say you have your population, you get the mesh terms for your population, you have your intervention group, you get the mesh term, what we call mesh term. So all these things are just basically demonstration. How can I do? How can I do? It's all about practical. So I'm going to use this opportunity to invite one of our chief systematic one of my chief systematic the reviewer, to talk to us briefly before our round up. So I'm sure I answered your question.
Yes, sir.
Yes, all right. So Madam Precious, it's a pleasure to have you.
Good evening, everybody. Good evening. Thank you all for being here for these past few days. It has been consistent back to back, and I want to encourage you all. This upcoming mentorship program is going to be massive, honestly. After this program, I'm sure that each and every one of us will be guided one-on-one. It could be held one-on-one in each section. I'm sure that by the end of the program, all of us will have been so good in doing all sorts of research, reviews, and all. So all of us, the whole team will be there to guide you, to guide and every one of us that will be in that mentorship program. So yeah, I want to encourage you all to participate. You don't want to miss it out. We will help you do a lot of things. We will help you even to the point of your publicate, and the point of when you have to publish your manuscript. So we'll work with you throughout the journey. So yeah, so that's all I have to say. Thank you for having me, Mr. David.
All right, yeah, it's a pleasure. Yeah, welcome. So it's very, very good. So I think we're almost coming to the very end of this session. Thank you very much. And I don't know if there's any other question. I think somebody is trying to ask a question. Somebody's trying to ask. Okay, Sally.
Okay, sir. I think in the two you have promised to share us the rock sheet, and we not see it in our Gmail, and it will be useful
Okay,
to us, sir.
okay. The gap identification too, right?
Yes.
Okay, yes. I'm going to share it right away.
Okay.
After the meeting, this. So
Okay,
I'm going
thank
to share it to each and every one of us.
you. Thank you, sir.
All right. So I don't know if there's any other question, but I'm sure there are no many a time, whenever we are done with our training, there are no always questions because at the end of the day, everybody is really, really satisfied. So I'll be able to see you guys in our mentorship session, lots of PhD students. You get to see a lot of PhD students who are going to be there, you know. And the reason why we are actually sharing it here is because of if we haven't really brought out the made the publication, but we're definitely going to make it as soon as possible. So please, I enjoin you that if you want to really be very good, not just in systematic review, right? You want to have that detailed experience in research writing. This is an approach for you. This is that. This is that training you don't want to miss. This is that place you really want to be. So we don't really have much to say about it, right? So we really understand. So why we're actually taking the most of the PhD students along. It doesn't matter whether you're an undergraduate. It doesn't matter whether you're single student, whatever you want to be, right? So you just have to pull yourself in. And like I said, we're going to start by having a detailed session with you guys, line by line approach. That's why it's 2 months, right? So it's really going to be worth it. And so we're going to start from. So we've trained a lot of persons before now, right? We've had numerous training, lots of patients with lots of patients who have actually had numerous publications, with us. And also, we're going to also supervise your submissions, and you just have to have your question there. Also going to show us how to use Covidence, pair us into groups, give us that exposure we want to have with wider community, teach us how to use Ryan for data extraction, how to use R and Revman for meta-analysis. It's going to be a clear-cut, practical session. So, like we said, this plan is going to be closing anytime from now. We don't really have much to say. We just need you guys to get in there and do what you're supposed to do. So for the PhD students, you can actually have up to 3 research questions that's going to span across that tree, that particular, 8 weeks. So it's going to be a very, very intense 8 weeks, and it's definitely going to come with your certification at the very end of it. So if you want to get that certification, that's where you really need to be. That is where you really need to be. So it's going to be from the very basic to becoming a trainer. You're not just an expert in writing, but being able to train people in writing systematically. So I want to thank each and every one of you once more for having me for the past 3 days. I wish you guys the very best of luck, and I want you guys to spend your time very well. I wish you guys the best. Thank you very much. Bye-bye. Thank you, thank you, thank you, thank you, thank you. Mm.